My name is Linda Carter. I am going to be your presenter today, and I just wanted to take a moment to introduce myself. I've been in clinical research for a little over 10 years. I started out by accident with Johns Hopkins University, and from there I've worked as a CRA. I've worked as a study coordinator for investigator-initiated trials. I've worked for a major pharmaceutical and vaccine company as trial manager and project manager, and I look forward to sharing some of my experiences with you with regards to the conversation that we're having today. And I also encourage you to offer your feedback if you have any questions or comments about your experience. I think that's a good way to help us have relevance with our program and our topic. So without further ado, why don't we go ahead and get started. We're going to be talking today about the updates to the informed consent. And during our conversation today, we're going to take a few minutes to talk about the three major documents that are going to be the core of our presentation today. These presentations should have already been provided to you, and I'm hoping that you've had a chance to read them, or if not, at least be familiar with them. We're going to talk about the first document that we're going to look at is a document on the proposed regulatory changes. And this is an advanced notice of proposed rulemaking that actually came out in September of 2011. These are the proposals with a number of interesting changes that are being considered. The comment period for this proposal was actually extended because it was so extensive. So there's really no final resolution at this point to this proposal. But there are some interesting questions to consider and what they might mean for our industry moving forward in the future. We're also going to look at one of the guidance documents entitled Guidance on Exculpatory Language in the Informed Consent. This is a draft guidance and has not been finalized yet. It provides information on what is and what is not considered exculpatory language within the informed consent. And when we review the contents of this document, we're also going to consider the implications that it might have on our industry. The other document that we're going to take a look at within this presentation is a guidance for sponsors, investigators, and IRBs. It's actually a Q&A on the informed consent. This guidance document is specific with regards to 21 CFR Part 50.25, and it's primarily focused on the language and changes that are related to the clinicaltrials.gov to clarify what is needed. So all three of these documents have been provided for you, and I encourage you to read them cover to cover if you haven't already. So the objectives of this course, we're going to navigate the regulatory climate that's related to the new guidance. We're going to be discussing the content of the guidelines and things that you need to know for each of these guidelines. And then we're going to present the implications of the guideline on current practices and policies and how this impacts our clinical trials. Before we get started, I want to present to you a little bit of a pop quiz. The answer to these quizzes will help us talk about what we're going to be reviewing throughout the content of this presentation. So take a look, if you will, and if you wouldn't mind, let's look at the first one first. It says, the current regulations governing human subjects research was developed years ago when research was predominantly conducted at universities, colleges, and medical institutions, and each study generally took place at only one single site. Do you think that statement is true or false? If you could just type in your chat box, either true or false. Okay, Aaron's group has given me a true.
Yes.
So you both have answered that correct. The answer to that is it's true. The second question, regulations have not kept pace with the evolving human research enterprise, the proliferation of multi-site clinical trials and observational studies, the expansion of health services research, research in the social and behavioral science, and research involving databases, the Internet, and biological specimen repositories, and the use of advanced technologies such as genomics. Do you think that statement is true or false? Again, please provide for me your answer in the chat box. Excellent. You guys are very fast. Correct. It is true. And then our last question is, if an informed consent contains language that a subject waives the right to be compensated for injuries arising from participation in the research, this is not exculpatory and is permissible per OHRP and FDA. Is that true or is that false? Excellent. You guys are very quick. You're absolutely right. It is false. Very good. So I think you guys are very much ahead of the game, and I appreciate your content and your feedback on that. So the answer to the first question is true. The current regulations have actually been slow to evolve, and this statement actually comes right from a document that we're going to be talking about today on the proposed regulatory changes entitled Human Subjects, Research Protections, Enhancing Protections for Research Subjects, and Reducing the Burden, Delay, and Ambiguity for Investigators. The second question, as you are all correct to say, is also true. The regulations haven't kept pace with evolving research, and that's pretty much self-explanatory. We know that, especially in the last decade, there have been dramatic changes, especially as it relates to technologies, database, electronic health records, genomics, advanced testing, and the storage of those specimens for future testing. So this question is true and also came from the document that we just referred to regarding the proposed regulatory changes. The third statement, you are all correct on that, is also false. The language here is unacceptable because the subject can never be asked to waive their rights for compensation related to injuries arising from their participation in research. We're going to talk about this more later, but this comes from the draft guidance document that you received entitled Guidance on Exculpatory Language and Informed Consent, and that was drafted in August of 2011 and has not yet been finalized.